No. Reports from health authorities in the greater Chicago metropolitan area have signaled a significant shift in the regional public health landscape following the emergence of a new hantavirus strain that appears to deviate from historical clinical patterns. According to internal surveillance data and preliminary medical reports, this variant is displaying an aggressive dual pathology, simultaneously targeting the pulmonary and renal systems of those infected. For decades, virologists have generally categorized hantaviruses into two distinct clinical manifestations: the New World strains, such as the sin nombre virus, which primarily cause hantavirus pulmonary syndrome or HPS, and the Old World strains, like the Hantan and Sol viruses, which are the primary drivers of hemorrhagic fever with renal syndrome or HFRS. The current situation in Chicago, however, involves a reported spike in cases where patients exhibit the severe respiratory distress associated with HPS, alongside the acute kidney injury and vascular leakage typically seen in HFRS cases. This hybrid presentation has prompted immediate concern among local epidemiologists and clinical staff, as it complicates the traditional triage and treatment protocols used for viral hemorrhagic fevers and zoonotic respiratory illnesses. The timing of this regional spike coincides with a period of heightened global sensitivity regarding hantaviruses, following the highly publicized May 2026 outbreak of the Andes virus on the MV Hondius cruise ship. While the Chicago incidents are currently being treated as distinct from the international cruise ship cluster, the discovery of a strain that attacks both the kidneys and lungs alike represents a notable evolution in the virus's documented behavior in North America. Hantaviruses are members of the Orthohantavirus genus, a group of negative sense RNA viruses within the Bunyavirales order. These viruses are naturally hosted by various species of rodents, including mice, rats, and voles. In the Chicago area, surveillance is focusing on urban rodent populations, specifically the brown rat and the deer mouse, to determine if a recent mutation has allowed the virus to bridge the clinical gap between pulmonary and renal failure. The implications for the public are serious, as the mortality rate for traditional hantavirus pulmonary syndrome is estimated at approximately 38%. With the added complication of renal involvement, health officials are emphasizing the need for rapid diagnostic testing and early medical intervention. As this story develops, the focus remains on the geographic distribution of these cases within the city's residential and industrial sectors, where human-rodent interfaces are most frequent. This report will detail the specific clinical findings, the response from leading health agencies, and the necessary precautions as Chicago confronts this emerging biological threat. The clinical and laboratory investigation into the Chicago hantavirus spike has mobilized a multi-agency response involving the Chicago Department of Public Health, the Illinois Department of Public Health, and specialized teams from the Centers for Disease Control and Prevention. At the center of the development is the laboratory analysis of blood and tissue samples from the recent cluster of patients. Virologists at high containment facilities are utilizing metagenomic sequencing and reverse transcription polymerase chain reaction, or RT-PCR, to map the genome of this new variant. The goal is to identify specific mutations in the S, M, and L segments of the viral RNA that might explain the virus's increased affinity for both the microvasculature of the lungs and the renal cortex. In traditional HPS, the virus primarily targets the pulmonary capillary endothelium, leading to a massive inflammatory response and leaky vessels that fill the lungs with fluid. In the Chicago cases, clinicians have documented a secondary phase of the illness characterized by proteinuria, hematuria, and a sharp rise in serum creatinine levels, indicating that the virus is concurrently inducing acute tubular necrosis or significant renal vascular inflammation. Hospital systems across Cook and Winnebago counties have reported a surge in intensive care admissions involving patients with unexplained flu-like symptoms that rapidly progress to a critical state. Official statements indicate that many of these individuals presented with an initial prodromal phase of high fever, severe myalgia in the large muscle groups, and gastrointestinal distress, which was initially mistaken for more common seasonal illnesses. However, the subsequent onset of acute respiratory failure paired with kidney dysfunction has distinguished this strain from previous hantavirus occurrences in the Midwest. The surveillance teams are also examining the spike in the context of urban infrastructure. In contrast to the rural settings usually associated with hantavirus exposure, these cases are surfacing in densely populated areas. raising questions about the role of the sole virus, a hantavirus specifically carried by urban rats that is known for its renal impact, and whether it has recombined with an indigenous HPS-causing strain. While some social media reports have suggested person-to-person transmission, officials have been quick to clarify that there is currently no verified evidence of such a spread in the Chicago cluster. This remains a critical point of contrast with the Andes virus, which is the only hantavirus strain confirmed to pass between humans. Current data suggests the Chicago cases are the result of independent environmental exposures to infected rodent excreta. The logistics of the response now include large-scale trapping and testing of rodent populations in affected neighborhoods to pinpoint the exact reservoir and the prevalence of the virus within the local ecosystem. As the scientific community works to characterize the new Chicago hantavirus strain, public health guidance has shifted into a high-alert preventative phase. The primary method of transmission for hantaviruses remains the inhalation of aerosolized viral particles derived from the urine, droppings, or saliva of infected rodents. When these materials are disturbed, such as during the cleaning of a basement, shed, or crawl space, the virus becomes airborne and can be inhaled by anyone in the vicinity. Consequently, health officials are urging residents to exercise extreme caution when performing seasonal cleaning or working in areas where rodent activity is evident. The recommended protocol involves a strict no-sweeping policy instead. Any suspected contaminated areas should be thoroughly wetted down with a 10% bleach solution or a commercial disinfectant to neutralize the virus before it can be disturbed. Personal protective equipment, including non-porous gloves and N95 respirators, is highly advised for those entering high-risk environments. Plus, the uncertainty surrounding this dual-organ strain underscores the current limits of medical science regarding hantavirus treatment. There is no specific antiviral medication, such as ribavirin, that has proven effective for the pulmonary form of the disease in controlled clinical trials. Treatment remains strictly supportive, focusing on the management of fluid balance and the use of supplemental oxygen. In the most severe cases documented in Chicago, hospitals have turned to extracorporeal membrane oxygenation, or ECMO, a process that bypasses the lungs and heart to oxygenate the blood externally. While ECMO can significantly increase the chances of survival, it is a resource-intensive procedure with limited availability. Furthermore, the renal component of this new strain may necessitate the use of continuous renal replacement therapy, adding another layer of complexity to the clinical management of these patients. Public health surveillance will continue to monitor for any expansion of the cluster, while researchers look for environmental triggers, such as shifts in weather patterns or urban construction, that may have led to the sudden spike in rodent-to-human transmission. The situation serves as a reminder of the persistent threat posed by zoonotic spillover events in urban centers. Authorities advise that any individual experiencing high fever, muscle aches, and sudden shortness of breath following contact with rodent-prone areas should seek immediate emergency medical evaluation, as early intervention remains the most critical factor in surviving hantavirus infection. We will continue to track official statements and lab results as they are released. For more updates on this and other public health developments, consider subscribing to our reports. The clinical and diagnostic profile of the Chicago cluster has placed the city's healthcare infrastructure on a heightened footing as virologists attempt to categorize this dual-pathology strain. Historically, hantaviruses identified in the United States have primarily been associated with hantavirus pulmonary syndrome, or HPS, characterized by the rapid onset of pulmonary edema and respiratory failure. This new manifestation, however, incorporates significant renal involvement, a hallmark of hemorrhagic fever with renal syndrome, which is more commonly documented in Eurasia. In response, the Chicago Department of Public Health and the Illinois Department of Public Health have coordinated with the Centers for Disease Control and Prevention to initiate an intensive surveillance program. At the hospital level, clinical teams at major medical centers are reporting a specific progression in patients, an initial febrile phase followed by the rapid development of vascular leak syndrome. This causes fluid to accumulate in the lungs while simultaneously triggering acute kidney injury, evidenced by sharp increases in serum creatinine levels and decreased urine output. Lab technicians are currently utilizing reverse transcription polymerase chain reaction, or RT-PCR, to detect viral RNA in patient blood and tissue samples, searching for the specific genetic markers that define this variant. The scientific investigation is particularly focused on the spillover mechanism within Chicago's urban environment. While North American hantaviruses are typically linked to the deer mouse in rural or suburban settings, the presence of renal symptoms often points toward the sole virus, a hantavirus strain carried by the ubiquitous brown rat, or Rattus norvegicus. Public health officials are investigating whether a mutation in a local strain or a recombination event has occurred, allowing the virus to target both the pulmonary and renal systems with equal lethality. To address this, environmental health teams have been deployed to high-density areas and industrial corridors to trap and test local rodent populations. This surveillance is critical for determining the viral load within the rodent reservoir and identifying specific geographic hot zones where human-rodent interfaces are most frequent. Preliminary lab reports from the CDC's Viral Special Pathogens branch indicate that the virus utilizes the beta-3 integrin receptor to enter human endothelial cells, which lines the blood vessels in both the lungs and the kidneys. Explaining the dual-organ attack reported by clinicians, logistically, the spike in cases has prompted Chicago area hospitals to review their respiratory and dialysis capacities. Because the virus causes systemic vascular leakage, patient management is notoriously difficult. Clinicians must balance the need for fluid resuscitation to support kidney function against the risk of worsening pulmonary edema and respiratory distress. In several documented cases, patients have required both mechanical ventilation and continuous renal replacement therapy, or CRT, putting a significant strain on intensive care resources. There is currently no FDA-approved antiviral treatment for hantavirus, meaning care remains strictly supportive. Public health agencies are also carefully contrasting these domestic developments with verified international data, such as the Andes virus outbreaks in South America, to ensure that no evidence of person-to-person transmission is emerging in the Chicago cluster. While current evidence suggests all local cases are the result of independent environmental exposures, specifically the inhalation of aerosolized rodent droppings or urine, the dual-pathology nature of the illness has necessitated a broader diagnostic net. Officials are now advising clinicians to screen for hantavirus in any patient presenting with severe flu-like symptoms, paired with either unexplained respiratory distress or sudden renal failure. The labs continue to prioritize genomic sequencing to determine if this Chicago strain represents a permanent shift in the regional viral landscape or a localized transient spike. In light of the dual-organ pathology observed in the recent Chicago hantavirus cluster, public health agencies have issued a refined set of preventative guidelines tailored to both residential and commercial environments. The fundamental challenge in managing hantavirus risk lies in the invisible nature of its transmission. Because the virus is shed in the urine, saliva, and excreta of infected rodents, primarily the deer mouse and the urban brown rat, human infection almost exclusively occurs through the inhalation of aerosolized particles. When dried rodent waste is disturbed by sweeping, vacuuming, or even foot traffic, the virus becomes airborne, where it can remain viable for several hours depending on environmental conditions like humidity and ultraviolet light exposure. To mitigate this risk, officials are emphasizing a strict protocol for cleaning potentially infested areas. Residents are advised never to use dry cleaning methods. Instead, any area showing signs of rodent activity must be thoroughly saturated with a disinfectant solution, such as a mixture of 1 part household bleach to 9 parts water for at least 5 minutes before removal. This wetting process prevents the virus from becoming airborne and effectively neutralizes the lipid envelope of the viral particles on contact. The shift in the virus's clinical presentation, attacking both the pulmonary and renal systems, requires an equally aggressive approach to personal protection. For individuals tasked with cleaning sheds, basements, or storage units in the affected Chicago districts, the use of non-porous gloves and at least an N95 respirator is now considered a baseline precaution. While the medical community continues to investigate the specific genetic drivers of this dual pathology strain, the limits of current therapeutic interventions remain a point of sober reality. There is currently no commercially available vaccine for hantavirus in the United States, and there are no specific antiviral drugs that have been proven to stop the progression of the disease once it enters the critical phase. Consequently, the focus of the medical response is entirely on advanced supportive care. For patients experiencing the dual attack on the lungs and kidneys, this often involves the simultaneous use of mechanical ventilation to manage respiratory failure and continuous renal replacement therapy to compensate for acute kidney injury. In the most severe instances, physicians may utilize extracorporeal membrane oxygenation, or ECMO, to oxygenate the blood externally, though this resource is limited and requires highly specialized intensive care staffing. Ethically, health officials are navigating a period of significant uncertainty as they balance the need for public transparency with the risk of causing undue alarm. While the spike in Chicago cases is statistically significant, authorities have been careful to state that the overall risk to the general public remains low provided that rodent proofing and proper cleaning measures are followed. This includes sealing entry points in homes with steel wool or caulk, keeping food sources in rodent-proof containers, and maintaining a perimeter free of debris where rodents might nest. The honest limit of current knowledge lies in the origin of this specific dual-system strain. Researchers are still determining whether this is a novel mutation of the indigenous sin nombre virus or an introduction of an old-world strain, like the Sol virus that has adapted to the local environment, until genomic sequencing provides a definitive answer. Surveillance teams will continue to monitor both human clinical admissions and rodent population densities across the Midwest. The closing message from the public health sector is one of vigilant calm. The emergence of a hantavirus strain that impacts both kidneys and lungs alike is a serious clinical development, but it is one that can be managed through rigorous environmental hygiene and early medical intervention. If you or someone you know experiences high fever, severe muscle aches, and sudden respiratory or back pain following exposure to rodent-prone areas, immediate consultation with a healthcare provider is essential. The window for effective supportive care is narrow, and early stabilization is the most significant factor in patient survival. We will continue to monitor official statements from the CDC and local health departments as the investigation into this Chicago spike continues. For ongoing coverage of emerging public health developments and deep dive reporting on global viral surveillance, consider subscribing to our updates.